Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's up, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 297 of the Ask Dr. Angela podcast. I'm completely blown away. I just said episode 297. I've been doing this for a minute now, and I've got to tell you, I absolutely love doing the podcast. It makes me feel like a little bit of a superhero, that and everything else that I do on a pretty regular basis, seeing a bajillion women, operating, taking call, being a mom, it's all pretty amazing and all in a day's work. And I'm just very grateful and thankful for the life that I'm able to live. So y'all know I get questions from all over the place, and the media people hit me up all the time. And so I got one about pregnancy. And so this query said, Dr. Angela, can you please address pain during the first trimester of pregnancy and when to call your doctor? And so, they're like, what are the likely causes of pain during the first trimester of a pregnancy? And so I said, well, first things first, it's really important to have established that the pregnancy is actually inside the uterus, or else an obvious reason for pain during the first trimester might be a life-threatening situation called an ectopic pregnancy. And so, in my office, we do a confirmation of pregnancy visit, which is where you come in and, the big piece of that visit is a transvaginal ultrasound where I actually look inside your uterus and make sure that, there is a baby inside the uterus, a fetus, gestational sac, yolk sac, that there is a pregnancy inside the uterus. That's first and foremost. So an ectopic pregnancy certainly could be a very obvious reason of pain during the first trimester. And then obviously there are many other less serious causes of first trimester pain that might just be normal cramps associated with the growing, stretching uterus. It might be gas pains, or maybe even perhaps something like a urinary tract infection. Those symptoms are usually burning, pain, frequency, sometimes cramping. And so, the author of this article that's going to be coming out also went on to ask me, the difference between normal abdominal pain and pain that signals a problem. And so this is what I always tell my pregnant moms or expectant moms. My general rule of thumb where pain in pregnancy is concerned is the following. Keep in mind, as wonderful and beautiful as pregnancy is, it is not always the most comfortable state of existence, i.e. you are going to have some aches and pains during pregnancy. But as long as the pain isn't happening more often than not, or as long as it's not getting progressively worse or more intense, or, as long as it's not associated with other things like bleeding, contractions, pressure, dizziness, lightheadedness, etc., it's probably fine. And my golden rule is always, when in doubt, call your OBGYN. Remember, this is what we do. Speaking of calling your OBGYN, I do happen to be on call this weekend, so I've been getting a lot of calls. They also said to me, Dr. Angela, what advice do you give women who are experiencing a lot of anxiety about miscarrying in the first trimester? And, I give a lot of reassurance. In my practice, we will see expectant moms as often as they need to be seen, to give them a peace of mind that they desire and that they require. And I mean, if that means an ultrasound to see the baby every day, then that's what we'll do. We also arm you with the facts, and the basic rate of miscarriage across all pregnancy is roughly around 15%. But once you hit that 8-week mark and we visualize heart tones, then that risk drops to about 3%. So if it's a lot of hand holding that you need, in my practice, we do that. We don't mind that at all. And for those women that are hesitant to call their doctors with their pains or worries because they don't want to be a bother, although I don't think that applies to any of my patients because people call me all the time, which I'm really grateful for because you're supposed to. But one of the things that I always tell women is remember, this is what we do. This is what your OBGYN does for a living. This is what we signed up for. So just remember, we are always here for you. I am always here for you. And, my kind of go-to line that I tell all my patients is 3 a.m. or 3 p.m. It doesn't matter. If you're ever in doubt or you have questions, please, please, please call. So just keep that in mind. And it's really funny because I got this query actually last week, and I thought to myself, well, damn, all these questions, I address all of this in my pregnancy book. You all know I just released my pregnancy book on April 16th, 2019. It's What to Expect During Pregnancy and Beyond. It really is amazing. It is as easy as this podcast that I'm doing for you. And I really mean that. It's very readable. It's very understandable. It's very relatable, which is one of the reasons that my brand has really been able to thrive, because I'm a very relatable person. It's very conversational, and it's funny as hell because it has to do with my daily interactions with women, not only in my office, but all over the world. And it really also chronicles my journey during pregnancy and, everything leading up to the birth of my mini, Francesca. So if you haven't checked that book out, please do so. It's called What to Expect During Pregnancy and Beyond. You can get it on Amazon. I really would love to get your feedback. So y'all know how this works. If you happen to have any questions, topics that you want featured on my podcast, you know where to reach me, www.askdrangela.com. That's AskDrangela.com. You can hit me up on any of my social media platforms. I'm on Twitter, Instagram, Facebook, and you can send me a direct email. I will get back to you. Thank you as usual for all of your love and continued support. In closing, I like to always leave you with a quote or a saying. This one's coming from Life's Little Instruction Book, and it is lesson number 178, and it says, learn to recognize the inconsequential, then ignore it. I'm going to say that again. And sometimes, a lot of times when I interact with women and meet patients and I say things to them, sometimes it's me actually saying it to you, but I'm also saying it to myself too. And this is kind of one of those sayings. So I'm going to say it again. Learn to recognize the inconsequential, then ignore it. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 298 of the Ask Dr. Angela podcast.